Hi, Dr. Peter Stapleton here, clinical and health psychologist and EFT researcher. I'm also an associate professor at Bond University in Queensland here in Australia. And what I want to talk to you today is about a recent 2018 paper that has been released in the area of EFT, emotional freedom techniques, or tapping, and it is a landmark paper. Now, this particular article and full details are below in the notes, so you can actually access that. Outlines clinical guidelines, recommendations if you like, to guide sessions of EFT, particularly for people with post-traumatic stress disorder. So this is the first time clinical guidelines have been published, and I want to talk to you about the ideas that are in that paper. Certainly urge you and encourage you to read that in depth, just so that you do have the full guidelines that have been endorsed by every major EFT organisation in the world. Now, the main thing about this particular paper is it does outline the time frames, the types of measures that we actually recommend for measuring whether or not somebody is meeting certain cutoff criteria, and how that might then differ according to the actual application of EFT to those people with PTSD or post-traumatic stress disorder. So the recommendations, just in summary, do recommend that we offer at least 4, at a minimum, up to 10 sessions of EFT or tapping. The recommendations also look at all of the research and do suggest that group therapy is effective, and it's certainly cost efficient for a lot of people. That for people with PTSD, group application of EFT is entirely appropriate, and actually the research is supporting that it indeed works. The research also supports in this paper that comorbid conditions that coexist with PTSD, commonly we might find things like stress or anxiety symptoms, or even full disorders, and even things like other types of depression, will also respond by following the protocols that we're actually suggesting here. The risk of adverse events occurring with the application of EFT or tapping for post-traumatic stress disorder are actually really low. And this particular paper outlines those particular concerns that may well be on somebody's mind, even if you're a practitioner, of what might happen if I actually start to apply this, and Pandora's box might actually open. What might happen then, and what does the research say about the likelihood of those types of things? So I can tell you that the frequency of that type of thing happening is particularly low. Obviously, we would always recommend that training in EFT be comprehensive, and if you are a health professional that's licensed to be able to deal with diagnostic disorders, then of course this may well be appropriate to add to your toolkit bag. If indeed you haven't got that level of training, you may well want to be guided by a supervisor or a mentor, or indeed be referring people on to somebody that perhaps are licensed health professionals that are also skilled in EFT. So we do know too that the research on post-traumatic stress disorder is also indicating that physiological biomarkers, so things like heart rate variability, brain changes of course as well, hormones, gene regulation, all of those things are actually responding after the tapping intervention or clinical EFT as well. So these are all reasons perhaps to actually consider using EFT in post-traumatic stress disorder, and certainly with clients, but also to be guided now by the actual outline of what's been published here. We certainly do recommend that if people are non-responsive, that after 10 sessions, perhaps individual therapy is escalated, and even medication is actually considered for those people as well. Now, these guidelines do indeed recommend certain measures that you might use, and our guidelines are based on the fact that scores in these measures are at a certain level before you would move on to the next stepped care plan approach that we're suggesting. We do tend to use the PCL, which is the PTSD checklist, and there are many versions of this available. It is only 17 items, but there's military versions, civilian versions, there's even specific trauma versions of this. So you'll find in the guidelines, when you read them in full, that it is a stepped care approach. That step 1 is, if a score is of a certain level, here's the recommendations for EFT. If the score is above that, then step 2 may come into play, and so on. So I do really urge you to have a look at this particular paper, particularly if you do work in the area of trauma. It is a really comprehensive paper, and it's almost a blueprint, if you like, to how to use EFT, what's the research in this area of post-traumatic stress disorder, and certainly feel confident that the evidence is out there to support this. So I hope you enjoyed this just short video just to flag that these guidelines are available now, and that maybe you could actually take them into your organisation, have people read them, have a discussion about them, and certainly have a look at some of the other videos that show the effect size of how effective EFT is, and how it is that the research is showing the outcomes are not due to chance and that indeed are visible to the naked eye. So I'm Dr. Peta Stapleton. I'll see you again in another video soon.